Hi, I'm Dr. Paul. When you're here, I go like, choke. I'm Dr. Paul. Here's another episode of Ask Your Pediatrician, and the topic for today is anxiety in children. Now, I always thought, anxiety is something you see in teenagers, maybe adults. But in retrospect, and having raised 10 kids, 4 from babies, we adopted a bunch older, I have seen anxiety in a baby. I've seen anxiety for sure in toddlers and younger children in my own family. One way that anxiety will show up would be with sleep problems, that extreme anxiety of being left alone. And this is a huge struggle for so many parents. I have other videos that deal with that topic, so please check those out. Let me start first with babies. If you have an infant that is just, you can't get them to feed, they just seem so agitated, and you yourself, the parent, are anxious, that you can't seem to settle that kid down. I have had countless times where, I've been blessed with somehow being able to comfort a baby. I mean, just, those grandmas and aunties and moms who they can hold a baby no matter how irritable they are and just sort of do the new parent dance and up and down, and the baby just calms down. If you're a parent with a relatively young baby and they're just agitated and you're not sure if it's your own anxiety, hand them off. Tag you're it. Let some other adult who's good with babies see if they can calm that child down. Because sometimes they just need to feel they're in a safe world. What's causing this anxiety is what's tricky. Anxiety, I believe, is a neurotransmitter issue. It really is issues like dopamine, norepinephrine, serotonin levels, and we have genetic glitches that make us vulnerable to having issues with excreting toxins. We have glitches that make us have problems with the methylation cycle. This is biochemistry. And those same glitches put us at risk for having imbalance of our serotonin, our norepinephrine, epinephrine, dopamine. So, it's chemical, folks. It's real. And I've seen, for example, some of my kids who are, let's say, severe autistic, who seem to be just anxious beyond belief. Like, looking out the window, for example, would just be threatening. And you'll see sometimes the flapping as anxiety rises. It's just sensory overload. And for those individuals, what they need is calm. And you'll see, I just so admire you parents who have had to deal with this issue, who can just be calm and just take that deep breath, be calm, be present for your child, but be calm. And that seems to help, right? Because if they're in a state like I'm usually at, because I'm kind of one of those more wound up type people, folks, your child, if they're anxious, they don't need that. They need calm. They need you to just be reassuring, loving, and there for them. As your child gets older, anxiety presents in interesting ways. So one of my sons had severe night terrors. I mean, this went on for, I think, years. Sleepwalking, fear of closed spaces. Well, my mother, who's a nurse midwife, said he was stuck in the tunnel. He was a 30-some hours of labor and then C-section. No wonder he was afraid of closed spaces. People think that, babies in the womb don't process. They sure do. There was no question he couldn't go through tunnels or confined areas. And that was just PTSD, I think, from that traumatic experience of trying to be born. But then, as we get older, is it toxins? Is it hormones? Is it, biochemistry, neurotransmitters? Probably all of the above. And so if you have a child who's anxious, depending on the severity, if it's really severe, you've got to get in and see an expert who really understands what's going on. There are some natural things that can be tried. There's some diet things that can be tried. You can do food sensitivities, make sure there's no foods that might be triggering an immune response that's somehow creating a sense of unease. Beyond that, there's being very careful about neurotransmitters and toxins in the environment, and also being very careful that you don't do more harm than good with your treatments. Because, us physicians, I'm an MD, and, we're trained anxiety, benzo. Here's your Valium or Xanax, or, those for an acute panic attack on an older, teenager or adult might be, very short term, very rare, necessary. But for the most part, you're going to create more problems than you've solved in the long run. Anxiety is a tough topic, folks. I see it in my ADD and my ADHD kids. I see it in my autistic spectrum kids and autism kids. And then we see just pure anxiety and depression. The link between anxiety and depression is also frequent. So this is not a simple topic. If your child is suffering, don't ignore this, because the anxious child, I've raised a bunch of them, when they get to be teenagers, if you haven't helped them deal with it, both meditation, getting enough sleep, and then dealing with diet, nutrition, avoiding toxins, if you haven't helped them get a grip on it, they self-medicate. And I mean, I've actually had one of my sons tell me it's his medicine, referring to alcohol or marijuana. And I hear this in my addiction clinic daily. Can't survive without it. So they turn to substances of abuse to deal with their anxiety. And short term it may work. Unfortunately, long term it creates more anxiety, more dependence, and ultimately more problems. Anxiety is a tough one, folks. Be kind to your anxious children and let them know you're beside them, you're with them, you're going to help them. They need a loving, nurturing parent and not someone who's just cold, buck up, get with it, punishment rather than empathy. I'm not saying you let these kids walk all over you. That's not at all what I'm saying. But try to help them deal with that stress and anxiety. I know there are a lot of integrative medicine approaches, acupuncture, massage, yoga, meditation. There's lots of ways that people have learned how to be present with themselves in the moment and maybe stop that spinning that's created all the anxiety. Thanks for watching. Leave your questions for me and I'll do my best. And if you like it, give us the thumbs up, support the channel, subscribe if you haven't. I'm Dr. Paul. Thanks for watching.